So good morning all. So in the last videos we have just started regarding the cardiac assessment. We have gone through the history collection. We have seen how the physical examination is being done. And now moving on to the last part of the cardiac assessment, that is moving on to the auscultation. Already we have discussed regarding the normal heart sounds. The normal heart sounds are S1 and S2. Okay, so that is a normal heart sound. Always remember that. And the normal heart rate will range from 60 to 100 beats per minute. Okay. Now next is moving on to abnormal heart sounds. Now abnormal heart sounds, when we anyone asks you what are the abnormal heart sounds, you might have already studied it in foundations of nursing. Now commonly you might have heard about thrills, murmur, click, snap, okay, and pericardial friction rub. These are all abnormal heart sounds. Now particularly it is very difficult for us to auscultate and find out regarding the abnormal heart sound, okay, but we should know theoretically what is each type of abnormal heart sound. And if you are able to go through the YouTube, you can also listen to these abnormal heart sounds, okay. So in all these abnormal heart sounds, the most important of it is actually a murmur. Okay. So we'll discuss regarding that also in detail. So first of all, abnormal heart sounds, most of the time we are using the bell. Okay, the bell of the stethoscope is used to listen to the abnormal heart sounds because they are a bit low pitched in sound. Okay, so the first abnormal heart sound, we call them as extra heart sounds. Okay, extra heart sounds. So extra heart sounds are abnormal heart sounds that you have to remember. So the first abnormal heart sound is S3. Then we have got S4. Then some other abnormal heart sounds are there like clicks, snaps, and then you will study in detail regarding the murmur and then pericardial friction rub. Okay, so this is all about the abnormal heart sounds. So first of all, moving on to S3. Always remember S1 and S2 are the normal heart sounds. Okay, the abnormal heart sound is first one. Next first one is S3. So S3 is referred as the third heart sound. Now S3 is particularly a low pitched sound. Okay, it is low pitched. That is why we are using the bell of the stethoscope to listen. Okay, and this S3 is usually heard during the early diastole. And there is one more name for the S3, that is ventricular gallop. Okay, in certain cases S3 is normal. Okay, for example during the time of pregnancy, sometimes in children, and during the time of exercise or when you are anemic, that time sometimes you can hear this S3 sound. Okay, that is a third heart sound and it is also called ventricular gallop. But most of the time this extra heart sound S3 is abnormal. It is pathologic in nature, and commonly it is associated because of myocardial ischemia. Okay, when there is a myocardial failure, most of the time you will hear this abnormal heart sound S3. Okay, so that is regarding the first heart sound abnormal, that is S3. So remember S3 is also called as a ventricular gallop. It is a low pitched sound and it is heard in early diastole, and moreover it is pathologic in nature and commonly it is associated after myocardial ischemia. The next abnormal heart sound is S4. Okay, so third heart sound was S3. This is the fourth heart sound, abnormal heart sound. Okay, so this S4 is called as atrial gallop. Okay, S3 is called as ventricular gallop, S4 is called as atrial gallop. Okay, and this is also an extra low pitched heart sound. Okay, it is an extra abnormal low pitched sound and it is heard in the late diastole. Okay, so you might have understood the difference in S3 and S4. Both are abnormal heart sounds, but S3 is heard in the early diastole. It is called ventricular gallop. S4 is also called as atrial gallop and it is heard in the late diastole. Okay, this is also a low pitched heart sound. Now this abnormal heart sound S4 is commonly seen as aging approaches, most of the time when an individual is having hypertension, myocardial infarction, MI, or when there is any stenosis or calcification in the heart valve. Okay, so that is regarding the fourth abnormal heart sound, S4. Moving on to some other abnormal heart sounds, clicks and snap. Okay, so you know what is like a click sound we do, no, isn't it? So same way the name has come. Okay, now click is actually produced because of the valve prolapse. Okay, you know there are the valves, atrioventricular valves are there, semilunar valves are there, isn't it? So heart is always having the valve. So what happens is when there is prolapse, okay, prolapse in the sense, most of the time when they lose the elasticity, the normal function of the valve is to close, isn't it, and unidirectional flow of the blood. Okay, but when the valve's elasticity is lost, what happens is they will prolapse. Okay, they, and because of the prolapse there can be backflow of the blood. The normal function unidirectional blood flow is not there, so instead backflow or regurgitation of the blood can occur in the heart valve. Okay, so what happens is during this valve prolapse, okay, when the valves of the heart are prolapsed, there can be backflow. That time it will produce an abnormal heart sound that is called as a click. Okay, now particularly so many types of clicks are there, it is not at all necessary. Two main types of clicks are there, that is ejection systolic click and mid systolic click. Okay, so first of all, ejection systolic click means, as it is told there in the word, systolic means it is heard during the time of systole. Okay, ejection systolic click is produced during the early part of the systole. Okay, and mid systolic click, it is produced during the late systole or mid systole. Okay, so these are the two main type of clicks. Okay, just remember what is the meaning of click. So click is an abnormal heart sound. It is usually produced when the heart valve is prolapsed. Okay. And next, moving on to snap. Now snap is actually again an abnormal heart sound. Okay. And it is high pitched. Okay. Most of the heart sounds were low pitched, but this snap is high pitched and it is diastolic sound. Why it is produced? when Whenever there is any stenosed valve. Stenosis means most of the time when there is any calcification in the valve and all, or when there is deposition of the, what we call fat, the valve will become stenosed, it becomes narrowed. That is called as stenosis. Okay, so prolapse is different, stenosis is different. Stenosis means there is narrowing. Okay, so adequate blood will not flow through. Okay, so whenever there is stenosis, it produces an abnormal heart sound called as snap. Next is moving on to the murmur. Now this is a very very important abnormal heart sound. Okay, so remember murmurs are also abnormal heart sounds, and most of the time why murmurs are produced? Because of the gushing of the blood, that is excess turbulence of the blood. You know, when there is a pipe, okay, what will happen when the pipe gets narrowed? What will happen? The amount of water that flows through the pipe will be increasing. Okay, the volume or the gushing will increase. Similarly, here also the turbulence of the blood flow will be there. It is not oxygenation. Oxygenation obviously will be reduced after some time. I am telling initially what will happen when the valve gets narrowed, okay, because of the stenosis or because of fat deposition, it will become narrowed. That time there is gushing of blood. Okay, so that is called as turbulence. Okay, so murmurs are produced whenever there is excess of turbulence of the blood flow. Okay, and there is any obstruction in the valve, usually at that time murmurs are produced. And murmurs are told to be like swishing sound or whooshing sound. Okay, you know, when much amount of water is flowing to a pipe, one type of sound is produced, isn't it? So similarly, same type of sound is produced here in the murmur. It is told that sometimes murmurs can be harmless, okay, because it can be heard during the time of hypothermia, anemia, excess of stress or exercise. But most of the time murmurs are also associated with cardiac diseases, especially when you have got any heart abnormalities or heart disorders, usually murmurs are heard. Okay. Now, moving on to the types of murmurs, it is not that important. Okay. So, different types of murmurs are there. First is systolic murmur, diastolic murmur, and continuous murmur. Okay. Systolic murmur is heard during a systole. Diastolic murmur is heard during diastole. Continuous murmur is heard continuously, both during systole and both during a diastole. Under systolic murmur, we have got three types: early systolic murmur, mid systolic murmur, and late systolic murmur. Early systolic murmur is heard during an early systole, mid systolic murmur is heard during a mid systole, and late systolic murmur is heard during a late systole. Similarly, under diastolic murmur, we have got early diastolic murmur, mid diastolic murmur, and late diastolic murmur. Okay. Now, early diastolic murmur is heard during early diastole. Mid diastolic murmur is heard during a mid diastole, and late diastolic murmur is heard in a late diastole. Then there is one more small term that is called pansystolic murmur. Okay. Now, pansystolic murmur, it begins immediately with S1. Okay, that is immediately it begins with the S1 sound and continues till S2. That is called as a pansystolic murmur. Okay, so types are not that much required for you. Okay, graduates are not, it is not required. But this grading you can just remember of the murmur. Okay, even though they don't ask it. So under the grading of murmur, we have got grade 1, grade 2, grade 3, grade 4 and grade 5. Now grade 1 murmur means it is very faint. If you put the stethoscope also, you have to listen to it very carefully. Most of the time you will skip also. You may not be able to listen to that. Okay. That is grade 1. Grade 2 murmur is very quiet. Okay. But if you listen carefully, you can listen. Alright. That is grade 2. Grade 3 murmur is moderately loud. Okay, and grade 4 murmur is more louder, and grade 5 is heard with the stethoscope partly off the chest. You need not keep it on the chest, slightly above the chest also you can listen. Okay, so that is regarding the grading of murmur. The next abnormal heart sound is pericardial friction rub. Now pericardial friction rub is a very important abnormal heart sound. From the term only you can understand here, pericardial friction rub. So this pericardial friction rub particularly is heard in disease conditions like pericarditis. Okay, we'll study in detail. Okay, in the coming classes. Now pericarditis means there is inflammation of the pericardium of the heart. You know the pericardium, it is a layer, isn't it? So here there is inflammation of the pericardium, and what happens when there is inflammation is, okay, you know the pericardium is a covering of the heart. There are many other coverings like myocardium, endocardium and all. So when there is inflammation of the pericardium, the chances are there that this layers will be rubbing against each other. Okay, so when they rub against each other, they will produce the sound like a scratching or grating sound will be produced, which is high pitched. That is called as pericardial friction rub. Okay, so when the inflamed layers of the pericardium are rubbing against each other, it is producing pericardial friction rub. Okay, and most of the time you can listen to this pericardial friction rub with the stethoscope. Okay, ask the patient to sit and slightly lean forward. Okay, and then at the end of the expiration you can always listen to pericardial friction rub. Okay, so that is regarding the abnormal heart sound, pericardial friction rub. Now commonly again, not only during pericarditis, even when there is pericardial tamponade. Pericardial tamponade means excess of fluid is accumulated in the pericardial sac. We know that some amount of fluid is present in the pericardial sac, isn't it? Normally, there is some amount of fluid present in the pericardial sac that prevents the friction. Okay, but when excess of fluid accumulates in this pericardial sac, that is called as pericardial tamponade. Okay, so during that time also what happens, you can listen to the pericardial friction rub. This abnormal sound is heard. Okay, so that is regarding the abnormal heart sounds. Okay, so we have finished regarding the cardiac assessment. So next we will start regarding the diagnostic procedures. Okay, each diagnostic procedure we will see in detail.